Now, specimen collection is critical. You need an appropriate sample, and the lower respiratory tract samples are preferred. But you could also take a combined nasal and oropharyngeal swabs. I'm going to show you a picture of a nasopharyngeal swab. When you do a procedure like this, you push something in someone's nose, they sneeze immediately. If they are infected, you could be in trouble. They could transmit the disease. So healthcare workers who are going to be doing this need to protect themselves. You know, even if you ask somebody to cough and produce a sputum in a bottle and you're standing next to them, you could be at risk. So you need to protect yourself. So there's also oropharyngeal, which could be taken in the mouth. I'm going to skip very quickly because we don't also have like your doctors and nurses will be actually doing this. But I put some slides just to give them an idea so that they could refer to in terms of, you know, collecting the sample. Number one, taking a sample, like when you do any procedure, we always taught, whether you went to a medical school or nursing school or any form of professional school, you'll be taught that before you do any procedure, you get your equipment ready equipment, you know, so it's important they do that equipment in terms of what they're going to use on the patients, including a tongue depressor, and also what they're going to use to protect themselves, and then up to when they would discard it. Where are they going to discard? They need to see all that before you start. Otherwise, it's a problem. You start a procedure and you don't know how to discard it, or you discard it in the street, and then kids will infect themselves. So the step one is equipment and material. Step two is record keeping. We see all these patients that don't have any province allocated to them in the report. It tells me one thing. Some of the healthcare workers who ask for this test forget to say this is from this province, which is not okay, you know, because we need to have that information so that we are able to know, you know, the epidemiology is very important. We must allocate everyone to their place of where they live. It is important for epidemiology. So record keeping is critical. Complete that form properly once you have all your equipment, and then you can collect your sample. I'm gonna skip this first because I think this is more relevant for you. People will be actually doing it, and it's very difficult to memorize all this to anyone. So I'll call upon these people to really use this chart when they are collecting samples. It is very, very important to comply with every single directive that we put here. This one is a directive for oropharyngeal swab. But I said earlier on, if they can give you a sputum, it's still okay. You can send it to the lab. Once you get your sample, transportation is critical with that lab request form. You send it to the laboratory, and then these are the details of the people who will be helping you. If you have queries, you've sent tests, samples, you have not received anything, these are the contacts that you are sending, that you're going to use. Northern Cape and Free State have the same details. It is not a mistake. The Northern Cape samples are processed in Bloemfontein. So you can see the Western Cape and all these places. The details are there with a person and a phone number, so that you know that if you are wanting to find out something in KwaZulu-Natal, you call Dr. Kanisile Msomi at Nkosi Albert Lutuli Academic Hospital Virology. The number is there. Now, for patients that you keep in the hospital or you send home, you might need to provide empiric treatment. It depends on the clinical syndrome that is appropriate as per doctor's assessment. Sometimes it could be labeled as a conventional community acquired pneumonia or typical pneumonia. All these conditions are quite common, and if you really want to give empiric treatment, go through our essential medicine list, the NEMLEC standard treatment guide, which you could download on your own phones. It's available. If you use Google Play, you'll get it. Standard treatment guidelines for South Africa, you will see all that, and you know exactly what antibiotic to be used at what dosage for what duration and all that, and how to monitor your patient. Now, when you manage patients at home while awaiting lab results, you need to make sure that this is a patient that is breathing well with good oxygen saturation, normal respiratory rate, normal heart rate, normal temperature, normal mental status as well, because that's very important. Others, they might not follow all your directives. Now, advice for patients that self-isolate at home, they should sleep in own room if possible. Use own bathroom if possible, preferably, and use surgical mask, keep social distance, wash hands, practice cough etiquette, clean the rooms properly, use own dishes and all that. So these are the things that you're going to tell these patients. But more important, if they worsen, they should come back. They should call the health facility. It is very important that the patient who sent home because they only have mild symptoms get to know all this so that they know what to do if things get worse.